Good morning to all of you. Yes, last class we were discussing about cardiovascular system. Am I sure? Yes. So you had a week of holidays. So you went back to your native place. Yes. Okay. So in cardiovascular system, we have missed two topics. So those two topics we will cover, and then we will go to respiratory system. What are those two topics? How do I know? So what is TMT? TMT அப்படின்னு சொன்னோம்னா அப்படி அக்னி மூன்று கம்பிகள் அப்படின்னு சொல்லிடக்கூடாது. TMT is treadmill test. What is treadmill test? We will discuss about that, and hypertension. So two major important topics. So first we will go with the treadmill test because we have already discussed about myocardial infarction, what is a heart attack, what is stenting, what is CABG, coronary artery bypass graft. That is, you harvest some venous grafts from your legs and then you connect the internal memory artery to the coronary artery. So you already know we have depicted how is a myocardial infarction happening. When there is cessation of blood supply to the heart, a part of the heart tissue goes for a what happens? What's the consequence of an infarct? காயங்களோட முடிவு என்ன? Yes, காயங்களோட முடிவு கழுவு, scar. When wound heals only with a scar. So what is a treadmill test? Treadmill test is a prognostic test. It's a prognostic test as well as a diagnostic test. It can give you some prognosis, it can give you some diagnosis. What diagnosis it can make? It can predict a heart attack. It can predict a heart attack. Okay, how common we can know otherwise? Already I have told you about the symptoms of cardiac illness: shortness of breath, palpitations, even with easy fatigability with small distances of walking, difficulty in doing activities of daily living like combing hair, wearing dresses, buttoning shirts, profuse sweating, not able to sit after eating. They go back, they feel very drowsy after eating. These are itself already they are prognostic and diagnostic values of an heart attack. But how do you prove it scientifically? So treadmill test is a dynamic ECG test. It's a dynamic ECG test. Generally ECG is taken in a stationary position. You ask the subject, lie down on a couch, you connect all the leads, and with the help of the leads you make some diagnosis. So some brief idea of what is T, what is QRS, what is ST, I have told you about in the ECG class. So this is a dynamic ECG where the subject is allowed to walk slowly, then run, and then almost around some 6 to 8 kilometers per hour speed is reached, and the ECG is monitored and it is correlated with the speed of the treadmill and what result it can give. Treadmill positive for inducible angina or negative for inducible angina. Positive or for inducible. So this will be the reports that you will இதுதான் நீங்க கீழ படிப்பீங்க. So treadmill report கொடுத்தோனே நிறைய ECG கடன்னு ஓடும் 15-20 பேப்பர். Have anybody seen a treadmill report? Okay, even if you would have got an opportunity, you would have missed it because you might it will be Greek and Latin for you. என்னன்னு தெரியல 20 பேப்பர் ஒரே ECG-ஆ ஓடுது என்னன்னு. சோ அந்த 20 பேப்பருமே படிக்கணும்னு தேவையில்ல. அந்த கடைசில இருக்கிற ரிப்போர்ட்ல என்ன வரிகள் எழுதி இருக்கு அப்படின்றத பார்க்கணும். Whether it is positive for inducible angina or negative for inducible angina. What is the remarks for that? If it is negative for inducible angina, there is no probability for a heart attack in the near future. Positive means the patient is having some amount of reduced blood supply. The chance for a heart attack is there. So this patient can be electively taken for a coronary angiogram, see whether where are the blocks and stents can be placed, or the patient can be put in for a lifestyle change or a lifestyle change. Any both the things can be done, and this is as far as the TMT is concerned. Systemic hypertension. Now you have to know what is systemic hypertension. Many colloquial terms, BP, Rathakodipu, so several terms are used indigenously or sometimes synonymously used, but the exact terminology what you have to use is systemic hypertension. It is a binumerical value, has a numerator, has a denominator. So last time, what is the normal pulse value? 72, 72, 72, 72, 72. 62? Yes. Clap yourselves, all yourselves. So 60 to 100. Below 60 is bradycardia. Above 100 is tachycardia. So similarly, any values can you suggest for blood pressure? There is a value here. 120, 80, 120, 80, 120, 80. Am I correct? This is the value what you got? Okay. This is the mean value. Like how, what is the, even the 72 what you said is not wrong. It is the mean value, average pulse rate. This is an average BP. So what's the range of the BP? So the numerator is called systole, the denominator is called diastole. Numerator, it can be as low as 90. It can be as above as 140. 90 lende 140. Numerator alone. Denominator 60 to 90. There are several people, sometimes even when you go for occupational health screening, you can go for software industries where there will be lot of girls. Low BP low BP low BP. So what is exactly low BP? How do you diagnose low BP? You need a blood pressure monitor to diagnose a low BP. Just because everybody Tom, Dick and Harry falling on the ground cannot be called as a low BP. So low BP, what is high BP, what is low BP? So this is the numerator, that is the systole. What is systole? It is the pressure at the heart during the contracting phase of the ventricle. This is the pressure at the heart at the relaxation phase of the ventricle. So this is the highest pressure the heart can reach, the lowest pressure the heart can reach. So it can happen in a range 90 to 120. Example, suppose your blood pressure is somewhere around 100 by 60. Is it normal or low BP? Normal. It is normal. Even 90 by 70? Normal. 140 by 60? Normal. So the upper range should fall within this range, the lower range should fall within this range. Any value below the 90-60, somewhere 88 by 58. So it can go for low BP, or you call it hypotension. You call it hypotension. Whereas above 140/90, 140 மேல இருந்ததுனா 140/90, above 140/90, it is called systemic hypertension. So systemic hypertension, the causes can be divided as primary, secondary. Primary hypertension is what is the commonest hypertension that you see is primary hypertension, or there is no other cause, or it is a lifestyle cause. Just because of your lifestyle change, you can land into blood pressure. Sometimes generally it is poorly understood as genetic. Genetic hypertension is a secondary hypertension where there is some cause. Generally என்ன சொல்வாங்க, அப்பாக்கு பிபி இருந்தது, எனக்கும் பிபி வந்துச்சு, எங்க தாத்தாக்கு இருந்தது, எங்க அப்பா இருந்தது, எனக்கு இருந்தது, எங்க அம்மாக்கு இருந்தது, எனக்கு இருந்தது, எங்க பாட்டிக்கு இருந்தது, எங்க அம்மாக்கு இருந்தது, எனக்கு இருந்தது. It is not like that. If the BP is like that, comes genetically, there should be some reason, there should be some hormonal changes. So that BP you call it as secondary hypertension. Primary hypertension is a 95% cause of blood pressure. 95 cases, if you see 100 cases of blood pressure, 95% of the cases are primary hypertension. The original cause of this is only lifestyle change. poor lifestyle. Secondary hypertension can come through different causes, like some tumors in the adrenal gland, tumors in the renal gland, or some hyperplasia in the arteries. Very rare. Rare things are rare, common things are common. So commonest cause of blood pressure, what's the commonest cause? Lifestyle. Poor lifestyle is the commonest cause of blood pressure. So okay, you diagnose blood pressure. Then how do you treat? Why I am discussing about some drugs of blood pressure, because you will be commonly seeing this in the prescription. So the common drugs of blood pressure are A, B, C, D. What are A, B? Yes? Okay, not the same. Okay, B are beta blockers. C are calcium channel blockers. I have not discussed drugs for anything, but this does everybody, even the Makkal Kedi Maruthuvam Thittamla Dabbala Matra Kondu Varanga illaya, ரெண்டே ரெண்டு மாத்திரை தான் கொடுப்பாங்க. ரெண்டு விதமான மாத்திரை, ஒன்று பிபிக்கு, இன்னொன்று சுகருக்கு. அதனால அந்த ரெண்டு மாத்திரையை மட்டும் கொஞ்சம் நல்லா தெரிஞ்சுக்கலாம். Calcium channel blockers, so again another blocker, and D is diuretic. ACE inhibitors. Okay. What are these four drugs? Beta blockers. So for this you have to know one formula. Cardiac output. Cardiac output is equal to heart rate into stroke volume. Have you come across this formula? Yes. So what is a stroke volume? One pump of heart, one contraction of the left ventricle, how much blood it will eject. Roughly around 50 to 70 ml each contraction of heart can send the blood. What is heart rate? You are 60 to 100. What is cardiac output? How much blood you need. So this cardiac output can be, it can differ. Suppose you are sitting in a class, you don't need much of cardiac output. But if you are going for a running race, you don't want to catch a train, catch a bus, or you want to shift all these stairs to the second floor, you need a lot of energy, then your cardiac output needs to increase. How will the heart increase its output? By increasing its stroke volume or increasing its heart rate. Generally it increases its cardiac output by increasing the heart rate. 10 தடவை படம் எடுத்துக்கிறது வல்ல ஒரு 20 தடவை படம் எடுத்துட்டு வந்தா நிறைய தண்ணி கிடைக்கும். But how does an athlete increases his cardiac output? By increasing his stroke volume. Generally his resting heart rate is less. Generally athletes have the resting heart rate low, 55, 56, 54, because அவங்க எடுத்துட்டு போற வாளி பெரிய வாளி, நம்ம கையில எடுத்துட்டு வந்துறோம் தண்ணி. அவங்க வரும்போதே ஒரு 25 லிட்டர் கேன்ல தூக்கிட்டு வந்துருவாங்க. Just for an example. So athletes bring more amount of blood, so they don't need to run like 100 times to fill this can. So ஒரு 10 தடவை போயிட்டு வந்தா போதும், அவங்க நிறைய தண்ணி கொண்டு வருவாங்க. So this is the concept of cardiac output. This is a very basic ideology that you need to understand. So how do BP tablets work? Beta blockers reduces the heart blood pressure by reducing the heart rate. Calcium channel blockers reduces the blood pressure by dilating the arteries. Tunica media. Do you remember tunica media? It is the middle layer of the blood vessel. By dilating the blood vessel, the blood pressure can reduce. Imagine a hose pipe. If you compress it, the pressure increases. When you open it, the pressure reduces. So this is by two mechanisms. How diuretics? By increasing the urination, the body's blood volume reduces. How AC inhibitors works? It works at the level of the kidneys. Kidneys are very essential to control the blood pressure. So it gives an extra effort to the kidney to control the blood pressure. So what are all the commonly used drugs in your Makkal Thedi Maruthuvam Thittam? So many thittams are there. So in AC inhibitors, angiotensin, so what all you will see is enalapril, commonly used drug. Then you will see telmisartan. I am not writing any company's name, so generic name you have to know. Telmisartan. Commonly used brands are Telma, Tazlog. So you will see your aunties, uncles, father, mother, anybody will be using some blood pressure. Enalapril, Envas. So I am telling the company name side by side, but I am not writing. Telmisartan, then olmesartan. So all sartans, prils will come in the AC inhibitors. Beta blockers, atenolol, metoprolol, all lols will come here. Calcium channel blockers commonly uses amlodipine, Amlong. This name you will come across. Commonly used. This is a very commonly used blood pressure tablet. Amlong. The company name is Amlong. You will come across. It's called amlodipine, nifedipine, and diuretics. You can come across furosemide, hydrochlorothiazide, So these are all the commonly used blood pressure tablets. So this you need to know, because whenever you come across a community health prescription, commonly used drugs, blood pressure tablet, sugar tablets will be the 90% occupying tablets of the prescription. Then one more common jam is the blood thinners, clopidogrel, aspirin, blood thinners. It's an antiplatelet drugs. It's used to reduce the incidence of heart attack and stroke. So the blood doesn't clot within the system. Already there is a system, that is a tunica intima itself doesn't allow the blood to clot in the system. But I have told you in the artery there can be some up and downs. So it can cause atherosclerosis, atheromatous plaques, and that can cause thrombosis, then thromboembolism, and then causing pulmonary infarct, cardiac infarct. Do you remember the sequelae that I have discussed already? Yes. Okay, with this we will end up cardiovascular system. Any doubts so far? Yes. So with this we will end up cardiovascular system. Next system we will go ahead is RS. So respiratory system. Respiratory system, it travels, the cardiovascular system and respiratory system are very synchronously working system. Generally the diagram is drawn like this. So this is your cardiovascular system, the respiratory system. So close they are. So close they are, and the most of the work for the blood is the oxygenation. So the oxygenation part is done for the heart by the lungs. So how do you go ahead with the respiratory system? So rough outline. So this is the anterior nostrils or the anterior nares. So through this you communicate your entire system to the world with the oxygen only through your nostrils. Generally you breathe only through your nostrils. or do you breathe through your mouth? Okay. So what's the ideology of breathing through mouth? Nose block ஆயிடுச்சு. அதாவது ஒரு additional pathway வா எடுத்துக்கலாமா? Yes. Okay, it's not an additional pathway, it's an emergency pathway. So வாய் வழியா மூச்சு விடுறோம் அப்படினா மூக்கு வழியா போகிறது பத்தல. It is insufficient. Generally obese people breathe through their mouth because அவங்களுக்கு nervesல வர காத்து பத்தாது. So என்ன பண்ணுவாங்க? கொஞ்ச தூரம் அப்படியே வந்து அப்படிவாங்க. They will have pursing of lips. Pursing of lips. So it is a commonest sign that they are having SOB, shortness of breath. So this terminology will be using frequently. What is the terminology? SOB, shortness of breath. So generally you breathe through your nostrils during emergency times, crisis, when the entire building is fired, you want to run. That time you can open your mouth and breathe because you want more oxygen in a short span of time. In emergency phase you can open your mouth and breathe. So the breathing center, so breathing it's a voluntary activity or an involuntary activity? So it is an involuntary activity having a voluntary control. So it is an involuntary activity. It is controlled by the midbrain. There is a center called respiratory center. The brain can sense the carbon dioxide oxygen level. When the carbon dioxide is more, it can cause more breathing. When the carbon dioxide is less, it can cause the breathing rate less. Okay? So breathing is an involuntary activity having a voluntary control. You can breath hold. You can hold your breath even up to 3 minutes to 4 minutes. You can hold your breath comfortably without any difficulty, but it needs practice. So the respiratory center is at the brain. It is a involuntary control, and the control is based upon the carbon dioxide and oxygen level. And what's the normal respiratory breathing pattern in male and in female? In female, it is thoraco-abdominal breathing. In female, it is thoraco-abdominal breathing. The thorax opens first, the abdomen compresses next to complete the breathing. In male, it is abdominothoraco breathing. It is abdominothoraco breathing. So this point you have to know. So breathing pattern in female it is thoraco-abdominal, in male it is abdominothoracic breathing. And how many breathing breaths do you need for a minute? Somewhere around 12 to 16 breaths per minute. Generally breathing happens subconsciously. You are not aware of your breathing. Are you aware of your breathing? Only when you are panicked, when you are anxious, when there is nobody around, when it is dead silence, you will be aware of your breathing. Generally, breathing is a subconscious activity. You are not aware of your breathing itself. Whether you take in air or you are exhaling air, nobody knows. Are you aware of your breathing pattern? No. So it is generally a subconscious activity. It happens on its own. Only when there is exercise, when you run, then you breathe fast, then it becomes a conscious activity. Okay, then how do you pranayamas and yogas, what do? They make breathing pattern a conscious activity. They make you aware of your breathing pattern and convert all your shallow breaths into a deep breath. So to understand this, you need to know what is tidal volume.